Welcome to Surgical Secrets with Dr. Nair, your front row seat to the world of plastic surgery and biopolymer removal. Thinking about a transformation? Or just curious? Revealing the facts and debunking the myths. Dr. Nair cuts through the noise. Surgical Secrets with Dr. Nair.
Hello and welcome to another episode of Surgical Secrets with Dr. Nair. I'm here with
Dr. Nair. That's me.
So today we're going to be talking about biopolymers. If you don't know, Dr. Nair is a board-certified plastic surgeon here in Miami, which is also a biopolymer expert. So I do have a couple of questions here to ask him, and I know so do you guys have to ask, and he's going to be answering it out here with us. Are you ready?
Yeah, let's do it.
Okay, so starting off with the first question is, what are biopolymers? Tell us about it.
So biopolymer is kind of like a catch-all term. It really is used for anything that's a foreign substance that's injected into the body. Most of the time, it's just freestanding silicone, but it can also be like cement or any kind of oils that people have had injected into their body.
Okay, and why are they dangerous? What's the whole point?
Yeah, so oftentimes they're done by women who either didn't want to have a BBL, couldn't afford it, or just decided they wanted to have like a non-surgical way to increase their buttock size or any other part of their body. So the danger in it is that, number one, it's not done by a medical professional. It's not really regulated by anybody. It's not substances that have been studied or approved by the FDA or anything like that. And they create problems with your immune system. They create pain, hardness, difficulty sitting down, and all these things just get worse as the time goes on. Okay.
What are the most common symptoms of these biopolymers that make it so dangerous?
There's a lot of symptoms people can have. I think probably the most common symptom would be probably pain. And that's just when people sitting down for a long period of time, they have a difficult time with pain. Other symptoms can be such as difficulty with walking, pain with walking, issues such as rashes, headaches, feeling lethargic, like they just wake up in the morning feeling very tired. And then you get these rarer symptoms, which I've taken one out of the little area underneath the eye, so you have some vision issues. Some people have difficulty walking and very, very severe symptoms. So it really is on all ends of the spectrum.
And what's the most common areas they inject it to?
For me, in my practice, the majority of them are usually the butt or the hips. Most of the time it's been abused as like a filler, essentially.
Okay.
And so most people use it to, enlarge the size of their buttocks or their hips.
Okay. So next question is, how can you avoid that?
How can I avoid it?
Yes.
Just don't get it done, honestly. I mean, it's not very great if you're getting a medical procedure done in somebody's house or somebody's hotel, and if the person that you're doing it with isn't a doctor. I mean, just don't get it done.
So it's no one with biopolymers or that struggled with biopolymers got it injected by a doctor. It's always
no, that's not true. That's not true.
Okay.
I mean, I know a lot of my patients have been, one of them, actually was done by a plastic surgeon. I'm obviously not in this country, was in another country in a very nice facility that he thought was, very respectable. So, a lot of it is just, if you go out of the country, the rules and laws and regulations are much, much different. So you really need to be very aggressive and very, conscious of what you're having done, because the same kind of rules that we take for granted in America don't really exist other places. So those situations, they have been done by doctors. So that's a little bit different. Majority of the time in the United States, it's not done by a doctor. It's usually done by, somebody who's has a hookup or something like that. So that's a little bit different.
Has there ever been a time in the United States a patient got it done by a doctor?
Not that I know of. There may have been there's a lot of controversy right now. I mean, there's a lot of semi-permanent fillers, which are fillers that are associated with plastics that are still FDA approved, that have been used for injections for penile enlargement and stuff like that. I'm not a big fan of it, but that's also my my practice. Like I'm very not into permanent things. If it's not regulated and it's not something that I can remove, I don't want to inject it into somebody, because if it becomes a problem, I don't know what I'm going to do with it. So the semi-permanent stuff have been popularized in the United States for certain situations that I'm not a big fan of. However, like in my knowledge, there has never really been a time where, board certified plastic surgeons were injecting free silicone, and that's not really something we did in this country.
What's the best way for patients? Like, you did mention that they should have an aggression to make sure that they're getting it done, that they're not getting biopolymers injected in them. Yeah. What are, like, let's just say 3-5 things that they could do to make sure that they're not getting injected to them? Maybe, like, as far as I know, making sure that they're board certified plastic surgeon, etc. Is there anything that you recommend to patients out there?
I mean, you just want to sway away from things that can cause problems. So anytime somebody says something's permanent, you really want to take that extra step and say, well, okay, what is it?
No, nothing that's injectable is ever permanent.
No, I mean, something like regular fillers, like they dissolve in 2 to 3 years. Everything that we've studied, they dissolve over time.
Botox, filler,
all that kind of stuff. So when you start getting into the whole permanent stuff, you have to figure out, okay, what is this conversation? Like, what does this entail?
It's most likely BS.
Yeah, it's just, you just want to take it with a grain of salt and say, hey, what's going on? Also, you want to study where it's coming from. If it's coming from board certified physician in the United States, majority of the time, it's going to be coming up with good backing of knowledge, understanding of the anatomy, somebody who, cares about their patients. Outside of the country, you don't know what that board certification is, so you have to just spend an extra amount of time kind of delving into what it is. There may be a language barrier as well, so those are things you want to take into account.
Okay. Is there any, let's just say they remove their biopolymer, is there any like reconstructions that they could do? What can they do after they remove it to still have a nice body?
Yeah, reconstruction obviously is very particular to each portion of the body. So reconstructing the butt is different than reconstructing the face and reconstructing the, eyes or anything like that. So they're all different techniques that go into it. Specifically for the buttocks, we usually go in and we try to do a lift during the first surgery. That gives a protection of the type of shape of the buttocks. After that, we can fill it up with either volume, we can fill it up with implants, we can fill it up with fat grafts, and that adds to the volume and allows us to try and fix the dents that we usually find in the hips. For other parts of the body, it really is tailored to those areas. So if you're reconstructing the face, sometimes it will need fat grafting to the face. You may need a facelift at the time. If you're going to reconstruct any other areas, such as the legs, it's a little bit more complicated. Most of the time when it's involved that area, you're just kind of revising the scar. So it really just depends.
And you do reconstructions on patients?
Yeah, I do reconstructions on all of my patients. It really just depends on what their goals are. If I can get them to that area realistically, what they want to do. I mean, oftentimes it's hard trying to have a conversation with a patient about, hey, let's do gluteal implants after I just removed something permanent out of their body. But again, you have to have that wherewithal of understanding that liquid silicone injected in an unsanitary situation that is not FDA approved is very, very different than a plastic surgeon using, FDA approved implants into your body. So those are two different things, but it is very hard because, you sense that, oh, I don't want anything permanent in my body ever again. Yeah. And that not necessarily is, the same thing. So
of course,
yeah, having that conversation may be difficult sometimes.
Okay. So so you do expertise in removing biopolymers, correct? What are your removal methods? How do you remove the silicone in the patient's bodies?
Yeah, so it depends on, again, the area. For the buttocks, what I usually try to do is I try to focus initially on where the silicone is. So every preoperative workup, Obviously, it gets a physical exam, so we take a look at any areas that can be problematic. But also, we do an MRI. So once we look at the MRI, I'm able to see, oh, there's a lot of silicone in that soft tissue space. There's a lot of scar tissue in that soft tissue space. Or there is involvement of the muscle that may change the way we operate or what I need to do to the surgical procedure. We also look at the hips and see how much involvement of the hips there is, as well as how much involvement of the lower back. Once we do those two things, then we're able to kind of tailor a plan. And very rarely will it change operatively, but most of the time, the plan that we do preoperatively is the same plan that we do operatively. And usually what that is we're tailoring the incision. So if there's a lot of silicone in the soft tissue space, then what I try to tell people is, the incision is going to be a straight line because I have to pull and cut as much tissue as possible. If there's a minimal amount of silicone in the soft tissue space, minimal amount in the muscle, then what we can do is we can give the nice butterfly incision, and that usually helps with either making the scar more socially acceptable as well as getting out the maximal amount of silicone. Now, oftentimes from those incisions, we extend it down through the hips, and then we're able to kind of go into the hips that way, clean up all the silicone in the hips, as well as cleaning it up off the femur as well, because the femoral head, which attaches to your hip, you can feel when you're doing the dissection. So those are the two ways that we try and do the excision. Once we do the excision, most of the times we do a lift, and that gives you a primary reconstruction. So it allows you not to have something where you feel like you're wearing a diaper or everything's sagging.
Okay, so for a patient's removal, the incision base is based on how much silicone they have in their gluteal area, their hips, their face.
Yeah.
Okay.
Well, for the face is a little bit different.
It's no incision in the face, or?
No, so usually, it's very complicated. A lot of these times, it really just depends on the patient. So sometimes I'll go through a facelift incision, depending on what layer of the face it's involved. So if they went deep and they went through the SMAS, then I really have to go through either a facelift incision or I go through the upper part of the cheek. But in the buttock area, it really depends on the quantity of silicone that's there. Every other area really depends on the location of where the silicone is and how much it is and where it's affecting.
Okay. I do remember the other day at the clinic, there was a patient who had biopolymers all around their gluteal areas, their hips, and in the front. So their incision was going to be like a whole circle as a tummy tuck. Can you tell us about that?
Yeah, sometimes people get it injected in the abdomen, or more commonly, just from years of sitting, it's moving the silicone into wherever.
So the silicone moves.
Yeah, so it definitely moves. So that is, in those scenarios, then we would do either a tummy tuck incision to try and get the rest of the silicone out, which is anteriorly, or we can make spot incisions, which are incisions right over that area or in the groin to try and get those areas out.
Okay. What do you recommend for the incision and the whole healing process?
In terms of taking care of it?
Yes.
Yeah. Unfortunately, just like any other long incision, it's a long incision. I think the thing that is problematic about this is that it's not clean tissue. So like when you're doing a tummy tuck, you're cutting and you're causing surgical trauma, but in all effect, that tissue is normal. The problem with silicone removal surgery is you're adding surgical trauma and inflammation to an already poor tissue. So that tissue has already had inflammation. It already has silicone in it. It already has poor blood supply. And then you're asking it to, I want you to heal as well. That's very, very difficult on the body. That being said, the body does really, really well with it, but it's asking the body a lot. So oftentimes, one of the issues that we see more commonly are seromas, which is fluid collection, which is often thought to happen because of the inflammatory situation, or something called dehiscence, meaning in the sense that these incisions, instead of healing the way we want perfectly, sometimes they'll pull apart. And what we try to do to fix that or to prevent that, obviously, is we want to have no smoking, a lot of protein intake to help healing process, and sometimes we do like offsetting sutures on the top, which is like a thing that we kind of buy on Amazon. It's like a zip tie, and it helps to offload the incision. But really, at the end of the day, you're fighting behind the 8 ball, so you're really just praying against hope that it just heals.
And how long is the recovery time?
It could take anywhere from about 4 to 6 weeks. It really just depends on the person, how they heal. I mean, I've had people, as a general rule, I tell people not to sit at 6 weeks, but I've had people that the incision looks fantastic. They're just healing well. They're just moving ahead of the rest. So, I mean, I let them sit earlier. And then I have patients that have more bigger issues. You know, they have either had a fluid buildup they can't get rid of, or they have repetitive like dehiscence or something like that, and those patients I stay a little longer, so you know you can't sit for about 8 weeks. So it really depends on the patient.
So after those 6 to 8 weeks, would the patient go back to a regular day-to-day life? That's it.
Hopefully it's better. I mean, you know, I've had a lot of patients. The last patient that we kind of did a thing on, when I first met her, she was like slumped over in a chair, and I was like trying to get her into the OR, and it was like, I'm like, I don't know how we're going to get her to the OR. Like, we need a wheelchair to get her to the OR. Like, you know, she was miserable. I mean, she couldn't walk. It was horrible. And then now, like, I see videos of her squatting, you know, like leading fitness classes. So, like, you know, it's night and day. I mean, like I tell people, you have to look at this as like, it's not cosmetic surgery. I'm not doing it because you want to have a bigger butt. We're doing it for these patients, either for their health, if they're asymptomatic, or trying to resolve a lot of their symptoms, which is like, I can't sit for a certain period of time. I have a lot of pain, you know, a lot of anxiety. So it's a different beast than regular cosmetic surgery.
What would happen if the patients never got it removed? Like, what delay would there be?
I mean, you know, there's a lot of complications that are going to be associated with it. We've had a lot of patients that have had silicone, not have it removed, and then, you know, they get in car accidents or they fall, and then now all of a sudden they have like an open wound that's draining silicone, you know, which is obviously horrible. On top of that, you get all the health issues.
Like, you know, a patient who's that has happened to?
Yeah.
And how is she doing?
She's doing good. I mean, she healed up from it, and then I ended up like removing it from her.
Okay.
Yeah.
Wow.
Yeah.
And she could have died.
Yeah, I mean, it's just verisome. I mean, yeah, obviously with anything you could have the possibility of death. It's good. What happened?
This thing is like going back, and like I don't want to look hunchback. Okay.
Yeah, I can't stop. You don't have any like anything back there, espresso, nothing. Shit, man. All right. Okay. What was the question?
The lady that you said that the silicone was like, what did I ask? If she was gonna die. Yeah. Die? Yeah. So can you die? Can you even die from biopolymers? Like,
yeah, I think there's two peaks of the mortality problem that happens in these patients. So on the initial injection. So again, if you don't know what you're doing and you're injecting free silicone and you don't have it under ultrasound, or you don't know the anatomy and you go too deep into the muscle and you hit it into the a vein, then yeah, you can die instantaneously.
But at the spot when they injected it.
Yeah, like on the table, you can pass away.
Okay.
Yeah. But after that situation, then there's a second peak, and that usually is associated with prolonged symptoms, a lot of inflammation. People can develop a lot of immunologic diseases, RA, SLE, all those kinds of things. They can develop a lot of pain. They can't sit down, and then sequelae of those surgeries. All those things kind of are associated with any kind of mortality. So it kind of goes on from there, and then you get movement of the silicone. So the silicone starts moving places, eroding into vessels, eroding into things, and that becomes a bigger problem. Mm-hmm. That's very rare, but it can happen.
Wow.
Yeah.
And that could cause death.
Yeah.
Do you know any?
No.
Pain. Okay.
Thank God, no.
Okay. Good.
Most of the deaths that we know of are, it's during the initial time they got injected. I mean, a lot of like popular celebrities or like influencers and stuff like that. There was one story like last year that influencer went to get silicone injected, and she passed away. So most of the deaths that we encounter with this is usually from either a surgical issue or on table when they got it injected. The person wasn't respecting the anatomy.
So even celebrities get this injected.
Yeah, I mean, there's a lot of
really common.
Yeah, I think
how common is biopolymer removal?
I think it's hard to know, because I think a lot of it, like, people don't talk about. It's very hush hush. People are very like embarrassed or ashamed of it, so it's unknown. But I would say it's a lot more common than we think. I mean, I think before doing operating on these patients, I would have thought, oh, this is few and far between. It's like less than 1%.
Here with you, I see it.
Yeah, every time I operate on someone, they tell me, "Oh, I have like 6 or 7 friends of mine that have had this done, and half of them don't want to remove, half of them do." You know, it's a whole thing. So I think it's way more common than people realize.
You as a surgeon, why would you think, like knowing all these effects and everything, like why would patients still not want to remove them? Because I've had hear that before from one patient who got hers removed, and she was saying that her sister was also suffering from it, but she's like in her own head, and she's told her so many times, and she just doesn't come to the point.
I think oftentimes, number one, because it's not really talked about in our community, even the plastic surgery community, there's not a like generalized information out there. So the problem is, if you don't control the information and standardize it, people just say whatever they want, and there's no one to like dispute that. So you have a lot of non-board certified plastic surgeons giving their thoughts and theories on things that are not very factual or just based on their experience. That's number one. Number two, there's a lot of anxiety for the patients. So the patients themselves, especially if they're asymptomatic, they're like, look, I don't have any symptoms. I'm fine. You know, I feel like I'm going to be okay. And it's hard for you to tell somebody who has no problems to go have surgery. That's a little bit difficult, you know? Usually like I feel like I have cancer, I need to have surgery. My gallbladder hurts, I got to have surgery. I want to have, my butt look better, I'm going to have surgery. But it's hard to say, hey, look, you're going to have an aesthetic poorer result even though you're not having any issues now because we want to avoid a problem 20 years in the future. That is a little bit harder to sell to patients. So you really have to talk to them about, look, I get it, but it's not going to be great later on. And I tell people all the time, you're never going to be as healthy as you are now. You're never going to be as young as you are now. You're always going to be older. As we get older, we have more medical issues. As that happens, your risk of surgery, any surgery, the risk of complications increase. So I tell people, look, you may not have symptoms now, but 30 years, 40 years down the line, you will. And it's a lot easier for us to deal with this now than it will be back, later on. So that's kind of what I do to try and convince people. And even patients that have symptoms are like, I need this out, I need this out. When you talk them through it and they get a picture, they look at the picture and say, oh, this is a scar I'm going to have. I thought we could just do it with this, or I thought we could just do it with lipo. They don't
get it removed.
Yeah, and then there's people that are like, look, I don't want to do it. And then then all you can do really at any point is, but all you can do really is give someone the information they need to make the decision. I mean, that's my job. My job is to give you what I think is the best option for yourself. But at the end of the day, the decision is yours. Like, you and your family can make whatever decision you want. It's just my responsibility to give you the best, option.
So how come if I'm not wrong, there's only 3 biopolymer removal experts here in America? Or 2?
It's not that. There's about 3 or 4 of us that do it like that. It makes up a big portion of our practice. Like, a lot of my practice is dedicated to, silicone removal. Okay. So that's what it is. Like, there may be 1 or 2 other guys out there that do a little bit of it. So, but I'd say there's about there's 3 of us that do a lot of it in the United States.
Okay. So going on to the next questions is, so tell us a little bit more about your expertise, about, how did you start with the biopolymer removal, your certification, everything, the schooling?
Sure. Talking about biopolymer removal, I mean, obviously, I did my general surgery training, board certified in that, did plastic surgery, board certified in that, and then did 2 fellowships after that. But it really was just because I was seeing a lot of these patients treated by other non-board certified plastic surgeons with a lot of these complications, and they would just come to see me for other aesthetic surgeries, and I would turn them away. I would say, you should go back to your surgeon, or, that's not something that I can do with this amount of scar tissue here. And they would just keep coming back. And so then I got to the point where I was like, all right, well, I mean, if they're not going to take care of them, then I might as well take care of it. So then I just started doing it, and I just started having good results and having, a lot of support in the community, as well as, amongst other surgeons. So it just started becoming a bigger thing for me. So that's just kind of backdoored my way into it, really.
Okay. And by any chance for the patients, like they get their biopolymer removed by you, do they always have to come again? Or is it with you? Is it always like a one-time removal?
No, no. So, with my protocol, it's pretty aggressive, my follow up. So, what I do is, we see you before surgery. Most of the times, we're talking well before surgery. I take a look at your MRI. We make sure that MRI is okay. After that, you have the surgery. Once you have the surgery, you come in for your follow up. So, your follow ups can range from, definitely post op day 1, but then after that, it becomes variable. So, post op day 3, 7, sometimes 3 weeks, 3 months, 6 months, then a year. Any of those ones are pretty variable. The ones that are definitely for sure are the 1 day, 1 week, 3 months, and then 1 year. And then I'd like to see everybody for every year of their life.
So usually they don't have to come to get surgery again, like to remove the body?
It depends. I mean, so that discussion we have at the 3-month mark. So at the 3-month mark, we redo the MRI and we sit down and we talk about, hey, how are you feeling? Is everything better? What issues do you still have, if any? And then let's look at the MRI. And then we compare and contrast the MRI from before surgery to after surgery. We say, oh, great. Look, we have like an 85, 95, 97% clearance, or we say, look, everything looks great. There's still some areas here. What do you want to do about it? And then in those patients, we discuss if there's a possibility of second surgery. But the amount of times that I've actually done that, I would say is, less than 1%.
Yeah, I don't think you've been having your own practice for about like almost a year now, and I've never seen a patient go for their second round.
Yeah.
Is it because you also take like 90% of the biopolymers?
Yeah, I mean, I'm pretty aggressive with my removal of the silicone. So, I mean, I'm not, the only time I will leave silicone on the table when I know I could have done more is if that I'm worried about the vascularity of the flap. So if my flap doesn't look like it's, got a good blood supply and I'm worried about it healing, then I won't be as aggressive. But anything short of that, I'm pretty aggressive about removing as much as I can.
So I do know that there's other methods to remove it. I've heard patients talk about other doctors, they remove it through liposuction.
Mm-hmm.
Can you talk about that?
Yeah, it's not a technique that I like. I think
Does it work?
I think it works in a certain situation. I think liposuction really was created, and this is vaso-assisted liposuction, was really created as a secondary adjunct procedure. I think it works really, really well for small targeted areas of silicone. I think that it doesn't really work well for an entire buttocks full of silicone. I think really at that point you should be making an incision and trying to extract as much as you can under direct vision. I think the liposuction area is great because you think that it's going to be non-invasive, the healing is going to be quicker, the results are going to be more aesthetically pleasing, and oftentimes that's not really the case.
Okay. So you recommend patients to just remove it surgically, like through the butterfly typical incision?
Yeah.
So to stay away from liposuction biopolymer removal?
Yeah, I think in my hands, as well as the guys that do this a lot, majority of the time we're doing it, overwhelmingly the majority of the time we're doing it open procedure.
Okay, so now we're done with the questions from here. So now I want to ask you more like, personal questions with you and your patients and the biopolymer patients specifically.
Let's do it.
So what would you say was your most complicated case?
My most complicated case, I think I had one lady who came in with silicone injected in Mexico. She had it injected by her eyes, and she had it injected by her in her cheeks, and that was a little bit complicated because, the face is obviously your face. You want it to be presentable, but it's also a lot of delicate structures in that area. So that surgical technique is highly difficult. So I went in through her lower eyelids, and then
Not that long ago. Right?
Yeah.
Okay.
I went in through her lower eyelids, and I was pulling out silicone droplets out of her like teardrops. It was crazy. And then I also went in through the upper part of her mouth.
Sorry, why does she even have it injected in her eyelids?
Well, I mean, it was done as like a tear trough filler, fillers that they had put in this area, but they just kind of migrated, and it was super small.
That's the worst part, to get it injected.
It was very, very crazy. Yeah, I was very, very nervous. I was pulling it, I had opened up the inner part of her eye and the underneath her eye, and it was there. That was crazy to remove it from. It was just crazy seeing silicone there, to be honest. And then, yeah, I was in her cheeks and like by her bone. So we had taken it off her bone through there. So like that was pretty cool to do. It was pretty interesting. And she was happy. She was like, and then the nice thing about it, like retrospectively, is like there's no visible scar, right? Because the scars are on the inside of your eyelid or like on the inside of your mouth, so no one can see any scar on you, which was, you know, kind of nice. And then you kind of got like a bleph out of it, so her eyes were sunken down a little bit. So that was kind of cool because the results were great. But while I was doing the surgery, it was great. I mean, her recovery is very minimal. I mean, you don't really, you know, you're recovering from a lower eyelid bleph and from a upper gum incision is pretty minimal.
And in the gluteal area, is there like, what's the worst part? Because I feel like that's the most common one. So
yeah, there's some rough ones I've seen. I got a lady who's got like multiple open sores on her buttocks. So, you know, that's going to be a bear to try and fix.
You haven't done her yet?
No, she's coming up.
Sores as in like what?
Like what? Open sores, like just like she either had like a BBL after having the silicone injections and then that got infected, and then you have multiple sores in that area and she's having a difficult time getting that closed. I've had other people with like just rock solid buttocks. I mean, it just literally feels like you're knocking on wood. And those are like very difficult dissections because there's no plane. Like when you're operating on those patients, you have to get to the plane of the muscle, right? And you usually have acknowledgement of the anatomy, but when that is just completely stuck together with scar tissue and silicone, there's no leverage you get. So you're really just basing it on your experience and basing it on.
So how does that make you feel, like as a surgeon, doing all this hard work, removing all these biopolymers? How do you feel about that?
Good. Exhausted. Good. I think it's a lot of work. I was telling somebody, like, I feel like I would say probably like 25% of my practice is maybe a little bit more, but is like silicone removal. Mm-hmm. But I feel like those patients take up like a lot more of my time in terms of like, you know, responding to messages, making sure they're okay. They're often, because I think there's a much more level of anxiety associated with those patients than the general like cosmetic patient. So I spent a lot more time kind of hand holding and making sure everything's okay. Like everybody after surgery will like send me like 50 million pictures of their incision, and oftentimes my incision just looks fine. And you know, I think I get that way more than I do like any tummy tuck incision or breast incision. I think there's oftentimes they're just so nervous about everything and they've just been through like so much. Fine. Yeah. So I mean, you know, it is a lot, but it is also like very, very rewarding. It's very nice. These patients are very, very kind to me. They're very, you know, supportive of me. And so it's very nice. Yeah, it's very nice.
Your biopolymer patients are the one that gives you the most.
Yeah, they're very, very sweet. Yeah. So it's really nice, like being able to help them out in a bad situation, especially when, you know, there are a lot of surgeons that either don't know how to do it or don't know how to do it well. So they just feel like they have nowhere to go, or they feel like they have to go out of the country. So, you know, it was definitely very rewarding.
And what's the longest procedure of biopolymers that you've done?
I did a flap at the hospital for about 7 hours.
Why?
So she was a lady who had, like I was saying, just like a essentially necrotic butt. The whole thing was like essentially dying. She couldn't sit down. And once you resected the entire buttock and lower back area, it's so much that I took out that I couldn't pull it together. So I had to rotate flaps from the back down and from the legs up to be able to get closure.
That's the one that her incision was like.
Yeah. So
an X.
She took me,
Wow.
Yeah, she took me up.
Can you like explain about the incision? I do remember that, but just for the people watching this can know. Yeah,
so I mean, if you think about the buttocks, like in that entire area, like imagine that entire buttock area being gone. So like now the only thing you see is the exposed muscle, and you have to cover that area because a person has to be able to sit functionally, right? That's the whole reason why we have it there. So what I did is I would create these large flaps on the upper back, and I would take it off the muscle and then rotate it down to create the top portion of your buttocks. And then I do the same thing on the posterior thigh. So if you take the posterior thigh, you make this incision as well, raise that flap, rotate it, and that creates the lower part of your buttocks. So those two flaps then rotate down to create your buttocks.
I remember her. She was like if nothing happened the next.
Yeah, she was.
Do you remember
awesome.
that?
Yeah, she was great.
I did a whole testimony on her. She talked about her experience. You guys could watch it on our Instagram. But when I tell you that this patient was like if nothing, like a whole smile in her face, not a single pain.
Yeah,
and it was a 7-hour procedure, and her incision was crazy.
Yes.
So there's reconstruction for that, like for even that type of.
Yeah, I mean,
especially
to be honest, I was surprised she healed so well. She's actually coming in, I think it's like in a couple of weeks for her final like 3-month pictures and stuff. But yeah, I mean, she was like, now I want to talk about reconstruction, which, when I first saw her, like we had a conversation. I was like, look, we need to get past this. This is a bear in itself. To get the silicone out and get you functional. Like, we can talk about reconstruction like later, but I mean, she passed all the things. So now at this point, like, yeah, I guess now we are talking about reconstruction, which is crazy. Seeing her when I first saw her, like,
what was she saying about reconstruction?
I mean, it was just
a BBL.
Yeah, we'll probably just do a BBL to give her some volume. She just feels like she lost her volume.
So what do you have to say for patients who do have biopolymers?
What do I have to say?
Yeah, like what you as a surgeon, what do you, it's hard and it's tough dealing with that, and especially for the patients who have symptoms over it.
Yeah, it's very hard. I mean, you feel kind of like you're alone. You feel like ashamed about stuff. You feel like you have nowhere to go to. Just realize like that's not actually the case. There's a lot of support groups, a lot of people that have the similar situation, a lot more people than you may realize. So it's not something that you need to feel alone on an island about. And secondarily, it definitely is going to cause a lot of anxiety. You just have to find a way to quell that anxiety to try and get past the scenario in which you're having a successful surgery. So that really is what is going to be very difficult, both mentally and physically, for you guys to deal with.
Can anxiety affect a procedure?
Yeah.
And in what ways?
Yeah. I mean, anxiety is always bad. I mean, it's normal to have a little bit of anxiety for a surgery. That's very, very normal. But you have to get to the point where it's not affecting how your surgery is going to turn out. It's not going to affect how your care is being provided. You have to just be able to rein it in. And, oftentimes that comes with a level of comfort for the surgeon, a level of comfort with an understanding of what the procedure is, and also a level of comfort of what you're expecting the results to be.
And like pre-op, let's just say the patient's about to have surgery, and with biopolymers, they're super scared. That anxiety, could it affect them? Like maybe their blood pressure being too high?
Yeah, I mean, I think
or
people...
is that...
I think people abuse that a little too much. I mean, I feel like oftentimes I'll come in and a hypertensive patient will have high blood pressure, and then they'll tell me, "Oh, it's just my anxiety," and
it's not.
It's really not. I mean, I get that it'll raise it a little bit, but it's not going to raise your blood pressure from 120 to 190. I mean, that's crazy level anxiety. So I think that I don't want to talk about that because I feel like that everybody uses that as a crux. So, oh yeah, my heart rate's like 100 million, but yeah, it's because of anxiety. And you're like, all right, I get it. But so yes, that definitely can happen, but I feel like it gets overused.
Okay. So what patient has impacted your life? Like when it comes with biopolymer removal, and has really affected you, like really touched your heart, and you're like, wow.
I think that, there have been a lot of patients that have been it's been like a tough scenario to like talk to them about, but excuse me, I think that a couple patients, like the one we talked about before where she wasn't able to walk, that was a little bit nerve-wracking. The other patient that she was talking about, she was a single mom and she wanted to she couldn't do the things that she wanted to with her kids.
Is she the one with the daughter that's always DMing you?
No.
You know who I'm talking about, right?
No, I don't.
The one that gave you like the character, the figure?
No.
She has a daughter who's always DMing you.
Oh yeah, I know who you're talking about, but no, that's not her. No. Um, what was the question?
Which patient, like, which procedure impacted your life a lot from
Okay.
Biopolymers?
Let me start again. Yeah, I think there's a lot of patients that have impacted me a lot. I think dealing with certain amounts, certain patients that are going through like personal issues, or they feel like they're really worried about their health or worried about their, possibly dying and stuff like that. That definitely gets to you, and you feel like you want to do something. Um, I think that, difficult surgeries I had, somebody that came from Ecuador who needed surgery but he was involved, with her nerve. That was a little bit scary. So
Does that happen a lot?
no, it's rare, but I mean, when it happens, it's pretty scary. Um,
Because they could like lose a leg or.
yeah, you just don't want to obviously injure the nerve. That's a catastrophic issue. But you got to do something because it's sitting on top of the nerve. So, that's a little scary. I think dealing with anything in the face, I think dealing with that one lady who had it in her eyes, that was a little bit nerve wracking because obviously you don't want to injure the eyes and cause any blindness or anything like that. So that was a little bit scary as well. Um, but I think realistically, every patient is just unique. I mean, what they come up with their stories and what has happened to them and why how they're suffering and stuff like that. It's so unique, and each one of them like kind of affects you in a certain way, and you just want to help them, take care of them, and make sure they're feeling better and they're able to live their life the way they want to.
And which one you said the teardrop was how do you pronounce it?
Tear trough.
The teardrop. That's the most difficult one you've done, right? The most craziest, like out of your whole career in Biopolymer.
Yeah, I would say that one was pretty crazy. Taking it out of the teardrops was nuts. I think that's pretty crazy. But I mean, probably doing the flaps, those are pretty nuts too, because it's like a hemicorporeal dissection. Like I'm literally dissecting your body. I'm filleting your body open from your knees to like your shoulders, which is crazy. So like having that level of dissection is, it's pretty intimidating because you're dissecting the entire body and you're relying on that flap to stay alive. So that's also that's a crazy moment doing that surgery.
What's the weirdest thing? Like, you know how you told me that biopolymers could be cement, it could be silicone, all of these substances. What's the most crazy thing that was injected to the patient?
Oil. There was like a weird kind of oil that I pulled
Like
from
car oil?
I don't know what it was. I mean, we were trying to figure it out. It was like this weird, like yellowish oil that just kept coming out that was mixed in with like this. I don't know. It looked like pus. I'm not really sure, but that one was a weird one, and obviously it was sold as hyaluronic acid, but
It was not.
no, definitely not. But that was a weird one. The mechanical silicone was weird. That was like. Yeah, like just silicone used for like cars and stuff like that. Yeah, that was nuts taking out of somebody.
Why do you even think these, okay, maybe they're not surgeons, but these people even have the heart to do that? Like, do they know what they're doing?
I don't think so, obviously. I mean, this was done, obviously it wasn't done in the United States, so.
I have seen articles that I don't know if it's like surgeons or people in general, they're arrested. They got arrested for injecting biopolymers.
Yeah, I mean, I was held prosecuting a case in New York, and I was held prosecuting a case in Houston over two people that have been involved with injecting silicones. But I mean, at the end of the day,
Did they do it intentionally? Those people?
Yeah, those people did. Yeah.
But what, like, instead of money?
Yeah, I mean, they're charging a good amount of money. I mean, they're charging like $9,000 or $10,000 to do these injections, which is crazy. But yeah, I mean, at that point, it's definitely not cheaper,
Mm-hmm.
But yeah, it's all financially motivated. It's all I just want to make money. That's really what it is.
And now they're locked up for like how long?
Well, they're still ongoing, so I don't know. We'll see what happens.
Well,
oftentimes they often get settled, to be honest. Yeah,
settled as in
like they get settled out of court, kind of thing. Yeah.
Well, thank you for being the one to remove it all and help all these patients. Every day we get new biopolymer removal patients with worry, stress, anxiety about it.
Yeah.
And hopefully, this podcast helps you guys know that you're not alone. Okay, this happens every day. We always have new patients coming here with Biopolymers every day, and there is a fix to it. Okay, the symptoms will stop. Everything would be fine. You just first need to prioritize your health, get it removed, and get in touch with Dr. Nair. Thank you so much for watching and joining in on our podcast, Surgical Secrets with Dr. Nair. Hope to see you guys soon in episode 5.
Bye, guys.
Bye, guys.